let's talk about x-rays and introducing x-rays. So I want to pull up a picture. I've already shown one picture of a pan with cyst. Here's another one that I had in my file. I like having this for patients to see. Keep it minimized on your screen, pull it up, and instead of saying you're due for x-rays today, what else can we say? What's wrong with that? For first of all, Eric, what's wrong with saying you're due for x-rays today?
Well, you're due. Let me tell you what you're due for. As soon as you start telling someone,
Telling.
yeah, as soon as you start telling, right? Doesn't matter how many initials are after your name. You know, my father-in-law and I talked about this a lot. It's like you can go get all the studies and all the things done, all the initials. At the end of the day, people don't like to be bossed around.
No, they don't. And is there a benefit in you're due for x-rays? I mean, there's no there's no what's in it for me.
That's right. Just being bossy.
Yeah. So Debbie, how do y'all usually say you're due for x-rays? Or
I usually present it when they come in. So Paula, the last time you were here, if you remember right, you had a number of areas that Dr. Hill and I were concerned about, areas around fillings that could possibly become a problem. Would it make sense to you for us to retake the x-rays to check for those cavities and make sure that nothing's getting any bigger? I know you've had some sensitivity, and would it make sense to check those out?
That's awesome. Oh, that's perfect. That's so good, Debbie. I mean, what are you doing there? Let's just dissect what she's saying. So, who's got some thoughts about what she's doing? Let's hear from you. Anybody want to share? What do you
She's creating value and urgency in getting these done.
She absolutely.
She's not just doing them for no reason. There actually is a reason behind it.
She's giving them that reason, absolutely, because people like to object to x-rays because they think it's just unnecessary expense. But now if we give a purpose, we're following that, what's the why? And then, so for a pan, instead of saying, you're due for a pan today, what's a benefit statement? If there were any cysts or tumors like this going on in your jaw area, would you want to know? That's a great way to bring that up. And say, the picture, the smaller pictures we usually take wouldn't show this. In fact, I don't know if it was this one. I don't think it was this one. I have another pan with cyst, and there's a cyst like right here. And the patient's teeth were starting to get crowded, and they were going to do some ortho. They did the pan, and they saw, well, no wonder the teeth are getting crowded. She's got a big old, I don't know if it's a cyst or a tumor, down here in the lower jaw area. And we had a patient like that, turned out to be cancerous, malignant, and she had to have it removed, and she lost some teeth. I mean, she was in her 20s, young mom. So I think people don't really get the why. And if we can have pictures like this, I would suggest that if you have some, take the names off. I don't know what patient this is, but take the names off and you just keep them minimized on your screen, and you're showing the patient, this is what we're looking for right here. And some of the pans are actually showing carotid arteries. There's a lot of value in that, or your sinus issues, or things like that. I mean, boy, this one's almost there. But what do y'all think about this? Is this a good way to introduce the conversation to your patients instead of just your due?
Yeah. Let me help you out, Paula. The patient's name is L. So it's down there in the bottom right corner. Yeah, this is L. Yep. And I don't know if you noticed, but on the jaw on the lower right, there's some caveman carvings on their jaw. This is an older patient. This is a much older patient there where the stick figure's walking. If you can't see that below, like it's like 23, 24 there, they're walking. 25, 26, they're walking right there. So we can always tell an age of a patient by that as well. You got to have fun with them. You got to let them know what's going on, but you also got to say, look, these are really concerned. Just like the medical history form. I don't say, hey, you're due to fill out your medical history form. There's no benefit in that. Doctor's got a lot of authority. You've got a lot of authority as a hygienist. So I say, and let me also say this. I should have already told them at the last visit what we'd be doing. So it would be a
Yeah.
reminder of that as well. So I do exactly what Debbie said, but I would remind them. Remember last time we talked about how today we would be, and then you just keep going, and what Debbie said was better than what I would say. And then doctor and I are both concerned about really making sure none of our patients have any sort of risk towards any cancer, any abscesses, anything like that. And that's why every single patient in our practice has a panoramic image taken every 3 years.
I like that. I like that a lot. And is it worth $100 if your insurance doesn't pay for it to find that out? $120, whatever it is in your practice. I like this medical history form update. You get some verbal skills here. We get objections to that. I don't have to do that again, you know. So there's some why in here. And how long ago did she have a heart attack? A 65-year-old woman comes to my office. She has many dental problems, fairly complicated medical history. I look at her medical history. I find out she's marked the following: heart disease or attack, heart murmur, high blood pressure, these things. And all elective non-emergency dental care should be delayed for 6 months after a heart attack. That's one reason we want to know. She was diagnosed with a heart murmur. What kind of murmur is it? Some of them can disappear. There's new guidelines to reduce the number of antibiotics required for inpatients who do need them for certain heart problems. What about blood pressure? How often does she see her doctor? What was her blood pressure the last time it was taken? Uncontrolled hypertension puts the patient at increased risk for another heart attack or stroke, maybe in the dental office. Have y'all ever sent anybody home because their blood pressure was too high?
Mhm.
We had to do that. Yeah. So this is fascinating to me. Is her diabetes under control? Uncontrolled brittle diabetes makes the patient more susceptible to all infections, including dental infections. So surgical dental treatment, dental extractions, gum surgery, biopsies may not heal properly. Isn't that interesting? Yeah, y'all probably know all this. I just think this is a really cool idea to let the patients know what's the why behind asking them for the medical history. They think it's just for us to see YA, you know, like radiation, the arthritis, hands affected, might have trouble with dental oral hygiene at home, medications.
You know, that's one objection we didn't talk about, Paula. Maybe we
Yeah.
did. I don't want to have x-rays because of radiation.
Oh, yeah.
People
Do
get
y'all
that
have,
one.
Do y'all have radiation charts? Exposure? Debbie, what do you usually
Yeah.
say to
What is it? What's your concern about having the x-rays? And if they say they're concerned about the radiation exposure, would you like to see some information that shows where in line with other things that you probably do every day, x-rays would fall into a category of either not as whatever.
Yeah, it's pretty minor in comparison to other things
Yeah.
they see on that chart. Yeah.
So
Used to be
here's,
able-
here's a sample. Do y'all have something like this in your office? Here's a radiation you would get from a single bite wing x-ray. Compare that to food and water. Look at this sunlight. And I've got another one. There's full body CT scan.
Can you send that attachment to us too? Is that?
Okay. Sure, I will.
Thank you.
This was a sample. You see it says sample on there, but I'll be happy to send that out to you guys. Having something like that, a visual, and
Your
yep.
your source, Paula, American Nuclear Society. Okay.
Yeah, how about that? Vermont State Department of Health. So that's your neighbor up there.
Scroll back up. Scroll back up for us. What was the PA? 0.01. What was it? 0.1. 0.1. Okay.
Yeah, so dentists use x-rays to safely, effectively diagnose, treat problems. Although x-rays do give off radiation, the amount is extremely small. Exposure is typically measured in units called millirems. Each year, the average person receives 620 millirems of radiation from all natural and man-made sources combined. This is the amount of radiation you typically get in a bite wing. So super low. And a mammogram? Oh my gosh, a mammogram? I need to find that one. Let me see if I can find it. Do y'all know? Do y'all have that x-ray comparison chart for mammograms compared?
I have it on the list that we have, but
Let's see if it's on this one. Okay, did my screen change for you guys, or do I
No,
need to?
this says 310.
Okay, so I'm gonna go back and share again. Here's this one. So you've got high dose. Look at the mammogram that they're getting every year, or maybe less than that now. This is your high dose group, medium dose group. Can y'all see this okay?
Yeah.
Then your low dose group, and here's your dental full mouth series, and then you've got digital pan. This is digital, which are less than the traditional x-rays. You would have to take 2,000 dental x-rays to equal the radiation in one mammogram. So you give them something like that, and it's like, yeah, I don't really have an objection here. I mean, they may still object to it, but, and that some people use the radiation as a screen. That's the mask of what the true objection is. They don't feel like it's necessary. That may be the real objection, right? Or maybe they just don't want to pay for it. They don't value it. So I can send you this one too, if you like. Would you like this? Yeah.
yes.
So these are great handouts for patients to have to help them get, you know, a sense of what kind of radiation we're talking about here. This is not like mammogram radiation at all. So, all right, what else do we need to review here, Eric? What have we left out today?
X-rays, building value. I think just simultaneous with that, we mentioned it yesterday, was just intraoral photos, your photo library.
Yeah.
I think a lot of times people go, oh, that's a good idea. That's a good idea. And they just don't do it. So
Yeah. Intraoral camera. I really like, you talk about building value and hygiene, and you guys probably do this, but I like using the intraoral camera on every patient every day. And especially the lower anterior on the lingual. I mean, they can't really see that in the mirror very well. And do y'all have a lot of patients that get, most of their buildup is in that area? You know, we had a patient call one day and say they broke a tooth. What really happened? Some of the plaque broke off. So you show them that before you get started.
that's why I work out front, Paula. I can't handle it.
Yep. So you take an intraoral photo shot of before you start the prophy, and then when you finish, that's a nice visual for the patient to get a reason for return. Reason for return, we talked about that some, didn't we?
Yeah, reason for return. You got to put that in your notes. You got to communicate that at the end of the appointment to argue for the next appointment. Yep, absolutely.
For sure. Okay, so what do you guys do to build value? So let's open your mics and let's have some discussion, Q&A. What are some things that you do to build value?
Think in terms of preventing cancellations, people appreciating what you do. It feels like you're going above and beyond. What are the things you do that sets you apart?
Yeah, so y'all can unmute. We can.
I think at the end of the appointment, like I try and do like a little brief review of like the day's appointment of kind of what we did, what to expect for the next visit, and basically why they need to come back.
That's
and I
good.
do that for restorative or for recare.
So we've got intraoral camera, reason for return. That's kind of like their report card of their visit.
Yeah.
Is that sort of what you're saying, Lauren?
Yeah, and then I also kind of go over if there's any questions that are lingering. And then if they have, because by that time their hygiene visit has already been scheduled, but they probably, if they have restorative that need to be done, that wouldn't be scheduled yet. So then I ask them the question too, is there anything that you could think of that would stand in the way from you scheduling your treatment that we recommended today?
Yeah, and you can ask that a lot of different ways. How do you feel about the concerns we have today? Right? How do you feel about the concerns that we have with those two teeth? How do you feel about moving forward with getting those scheduled? It's an open-ended question. It's very soft. It's very, I care about what you think. That's what you're asking. It's very concerning. And I will say too, on the report card, we used to use multi-code, like explosion codes, multi-codes, and you could list out all the things you do for no charge. They work, they don't work. I mean, you're not handing them to the patient chair side. That's something the admin does. And by then the patient's going, folding it up, throwing it in the bag, or like me, I stuff it in my pocket. And now it's just paper. I don't want any paper. Don't waste the paper, those sorts of things. So you may come up with a different way where you can run through your checklist. It could be audible, or you could do something that you have just, in your room. Here's all the things that we're doing, maybe on your screen. So try to think of ways that you can create that added value without putting it out on a receipt, maybe up front. But the multi-codes do work for some practices. We used them for a while, and it eventually just got too cumbersome. The ledger was just full of all these things, and patients weren't wanting the pieces of paper anymore. They had kind of seen it for a while, so maybe we needed to change it up and do something different. So we switched to a different system, and that was more of a chair side, audible. Here's all the things that we did today. And we went through everything.
I really like that. I mean, it's kind of like if I go in the grocery and I get 3 bags of groceries and I spend $100, I got ripped off. But if I get 10 bags for $100, man, I'm a good shopper. Yeah.
One thing in a bag.
Yeah, right. That's what they do now. They have these plastic bags. They put one thing in each bag, so it's a psychology of going on. How many of you code out like oral hygiene instruction, whether you charge for it or not? Do you code that out? What about tobacco counseling? If you talk to someone about smoking, or nutritional counseling, there are codes for that. Y'all know those codes, right? So
Yep.
Are we putting them on the walkout statement?
Those can be in your
We don't.
multi-code. You can create a
Yeah.
multi-code for your prophy that has all of those things in there. Yeah.
I would highly suggest you do that, and blood pressure too. Like, if create a code for blood pressure that you took it. If you're doing anything like that, I know some teams are using the oral DNA kind of under the microscope. Is anybody doing that? They're looking at the swab under the microscope and showing the patient the bacteria. That's another thing people are doing. So I got this. I just want to share one of the reasons why I'm suggesting you code everything. Code everything, even if you don't charge for it. Here's a story, a scenario I heard. Eric, maybe you've heard this. I don't know about insurance. So let's say, the insurance companies are always looking for a reason not to pay. Is that true? For any kind of reason. So there was a scenario passed down to me that the insurance companies, here comes a patient with rampant decay, maybe Mountain Dew mouth. Do y'all have that up here? We have that in Tennessee. We have meth mouth and Mountain Dew mouth.
Do you?
Yeah. So let's say we've got rampant decay, and then we send that to the insurance company, and they say, well, in looking at the history of the claims you filed for this patient, I never did see any oral hygiene instruction given to this patient. They've been coming all this time, and you never coded out oral hygiene instructions, so we're not going to pay for this. Can you imagine they would do that? I mean, surprise, surprise. Yeah, so there could be a valuable reason to, you're probably putting it in your notes, right? That you go over that, but I'd say add it to their visit. What do you think? Would that be a good thing to do?
Yeah.
Okay. All right. So why don't we open up some Q&A here, and then we'll get into action items and aha moments. So
Yeah, and I wrote down products and just periodontal systems that people use, like modular therapy, and what you guys are doing. Are you guys all, when you see a gingivitis patient, right, and you're helping them avoid going into perio, are you recommending an electric toothbrush, water pick, a product that they mix in the water pick? Tell me what you guys are doing. Let's see what everyone's doing here. So Debbie, why don't we start with you? What do you guys do in that case?
Water pick, electric toothbrush, could be rubber tip, Floridence.
Is that what you
Soft
recommend
picks.
in the water pick? Do you have a solution that you recommend, or?
I don't, just
Okay.
plain water
Okay.
on our end.
is anybody doing pre-rinses?
Everybody's doing
I've
pre-rinses
seen a
now.
lot of people starting to do that now since COVID. What are
COVID,
you
yeah.
using for your pre-rinse?
We're using Crest 3D White mouthwash, and
Okay.
then we're actually ozonating our water. So
Yeah.
we're mixing that with ozonated water.
Yeah. That's awesome.
You mix the Crest with the ozonated water? Okay. And what do you say to the patient? What's your verbiage for that?
I give them the rinse and I say, we're using a combination today of Crest 3D White, which is an over-the-counter mouthwash, and it contains hydrogen peroxide, which is a good surface antibacterial. It's going to kill lots of germs. And then we're also ozonating our water and all the water that we use in your mouth today. And that also has an antibacterial component. So you're getting a double dose of killing all the bugs that we can on the surface while we're cleaning your teeth today to keep you safe and to keep me safe.
There you go. Yeah. And they rinse for 60 seconds or
30. We're doing 30 seconds.
30 seconds? Okay. All right.
Yeah. What are y'all using? Lauren, Kayla, Julie?
Use
Julie, you want
Paradex or chlorhexidine with alcohol when we can. And I always tell them to rinse for a minute because then I figure they do it for 30 seconds if I say a minute.
Yeah.
Unless
Yeah.
they're C, and then I can just tell them exactly how long.
Here's the clock.
But what was that?
I say have a little timer, a little bell ding.
Yeah.
What's your products
time
that you
them.
guys like, Lauren, in your office? What do you guys recommend?
I mean, we have so many products, which is so nice. We do, of course, water pick, electric toothbrush. We have Oral-B's and Sonicares. And then we have, I feel like any tool you can think of for products in terms of, I mean, we have Floridence, we have toothpicks, we have the little, I can't think about the end tufted brushes, rubber tips. What's
Yeah.
the flossers?
Gum stimulators.
Yeah, we have like everything.
Yeah.
I mean,
Proxy brushes.
yeah.
That's
Yeah,
good.
these guys, I mean, I wasn't around for any of that. These guys do a really good job at like
Good.
keeping a great inventory of any type of thing you can think of.
Katie, what do you guys offer?
We use the Paradex rinse, the Reach floss handles for their molars and wisdom teeth. That's pretty much all we're offering right now. Doctor really likes just the original Crest toothpaste, so we always recommend that. Biotine rinse, the Biotine gel to put on. I would say that's about it, really.
Anybody using the peroxide pre-rinse? Because peroxide does a great job too.
We use the ozonated water rinse before.
Okay. Oh, good. So we had a leadership retreat with most of your doctors on here last April, and we had one of my clients who lives pretty close to me actually gave a talk on the ozone generators and the ozone water. And so it got them all fired up about this, that was right during COVID. So it was perfect timing for that kind of thing. So peroxide rinse is good. Anybody using the HVE suction? You know what I'm talking about?
We're doing isolate for.
Isolite?
Yeah.
That's good.
We're doing the leaf.
The leaf? Yeah, I was going to ask if anybody's doing it. Do you like the leaf?
Yes and no.
Yeah.
It like folds
Depends
back on the cheek.
Yep. Depends on the patient.
Yeah, right.
I love the leaf. I started using it before all of this because my arm was starting to bother me from holding the suction.
Yeah.
Yeah.
And it made a huge difference. I do try to use the isolite now if I can, but it's a good backup.
Some are asking the patient to hold the suction.
Yeah. Hold Mr.
Yeah, so
Christie.
Debbie, do you know too, because the leaf I feel like works for more patients. Do you know if that does the same as at aerosol, like at sucking up
Reduction.
as much aerosol as the isolate does? Do
You know, honestly, I don't know.
They're both high-speed suctions.
But they're high-speed suction, so it falls
I know
under the
there's
parameter.
been studies on the isolate, so that's why we've been using that more frequently, but I didn't.
Yeah, that I
What's-
don't know.
What's the one, Paula, that we were looking at with the retractors and then it had the suction right in the front? Oh, Zuction with the X.
Oh,
It
okay.
It has the high speed, just sits right on the lower lip. And then it uses the retractors to pull back the lips. And then it just, any aerosol that's coming out, it uses. So I don't know if anybody's using that one, but that seemed to be something people were excited about too.
Here is a study that was done, and this has it doesn't have the leaf on here, but it has ISO dry and the aerosol dam suction funnel. So I don't know if this graph
So the lower the better. Is that what it's saying?
information. Yeah. ISO dry HVE. There's 3D RD. There's funnel. There's RDH. So the aerosol control. So I don't know if that gives you any answers that you're looking for. Okay. All right. So, anything else related to COVID that you're doing? I know, didn't Dr. Pierre have the dry cup? Is he still using the dry cup?
I think he uses it, but I've never used it.
He uses it if he can't use the isolate or something along those lines, I think.
Mm-hmm.
That's good.
Yeah, it's more external versus the internal suction. Yeah.
Anybody doing the fogger in the office at the end of the day? Yeah. What kind of
Between
fogger?
every patient.
You have
We
what?
do it between patient. We do it between every patient.
Oh, wow. Okay. That's cool.
So you have the HOCl mix ready to go, and then you're putting it in the what vac did you get? What fogger? Do you know what product it is?
I don't know the name.
We
of
actually
it.
create the
There.
hypochlorous acid in the office. We
Yeah.
do tap water and salt in the morning and run it through the generator and add it to the machine that day.
Yeah, yeah, you're
That's
making
low
it.
cost. That's a really great way to
Yeah.
lower your cost. Yeah, for sure. Okay. All right. What
I'll-
products?
Let me
Go
let
ahead.
me just jump in on that. Look, the number one thing, 2021, if you look at any marketing, right? Any company that's marketing, the number one thing that they're recommending that you focus on your marketing efforts is safety. And I know, like with Dr. Netzley's office, we're in the middle of making a video on what we do to keep the patient safe. But it's, I mean, I've got tons of Dr. Slava's office. They did a phenomenal video. If you haven't seen that,
No.
Ehab did on the
Why don't you show it? Can you show
Radicate.
it?
I'll look it up. Yeah, I'll look it up. And it just did such a good job on it. So if you can figure out how to do your own in-office tour on what you guys do to show it's that what you're doing, make people safe, put it on social media. We send the link out on the email, the text message system, everything. So
Yeah.
Do it like when patients are in office, but we don't have anything because we're using the fogger after every patient, you hear it all day long. And so like that prompts us to be like, oh, you can't hear me talking right now because that was the fogger.
yeah.
Yeah, that's good. Yeah, I've had some teams do some videos. Some of them were just short videos. Some were longer. Do y'all do any videos for your social media? I know, Dr.
No.
Netzley, haven't you done some videos on your social media? I know you put your house progress on social media. Yep. The farming dentist. That's what you are on Instagram, right? So you can look him up. The farming dentist. You can see his videos about the house he's building. He always has a really good story.
The gophers are eating all my fruit tree roots.
Oh, really? Oh,
Uh,
no.
I put chicken wire and they're coming through that like crazy.
Oh,
So now
man.
I'm putting stainless steel wire.
Oh, that's a bummer. That's a bummer.
All right, I've got it ready, Paula, but I've got to.
Got it?
Yeah, when I do this, I've just got to make sure I share computer sound. Don't make fun of my desktop. All right, here we go. Got a lot of things on there. Let's see. Can you guys see that so far? Looks like it.
Yeah.
All right, let's see if we can hear it.
Yeah.
COVID-19 has impacted all of us. And here at Greenwood Dental, we knew we had to figure out a way to keep our patients safe. We have added some new disinfecting protocols. With that, we added the air sterilization system by Radicate. I have a background in surface analytical chemistry and 20 years of semiconductor experience, also in design and implementation of clean rooms. I have a very good understanding of how to clean the air from particles or particulates. The virus killer by Radicate is one of the best ways to do this. The development of the virus killer was due to the SARS outbreak in 2003 in South Korea. Over 80% of hospitals in South Korea have installed this Radicate, as well as in 100% of all lung units and lung examination rooms. I've researched many air purification systems, and this one really stood out. And the reason why is it's one of the only systems that will clean the air in a single pass. Here's how the virus killer works. It draws dirty air through the pre-filter and the HEPA filter. The pre-filter is used to filter out pollen or any kind of large dust particles. And then the HEPA filter removes anything greater than 0.3 microns. Anything smaller than 0.3 microns will go through into the titanium dioxide oxidation chamber, which has UVC lights that activate that oxidation process that tears apart the bacteria and the viruses. So what emerges is clean air. Anything over 6 air exchanges per hour provides surgically clean air. So our units are anywhere between 7 to 8 air exchanges per hour. The technology is new to the United States. We are one of the first offices in New England to install these, and we're very happy that this is here to keep our patients safe. I know you're nervous coming in, but I want to alleviate that concern by letting you know that we've added this new technology to help clean the air so you can feel confident and safe in making your appointment here at Greenwood Dental.
I wish that would have been first. That was the lead, right?
Yeah.
If you had led
That's
with,
great.
I know you're nervous about coming in, but let me reassure you with what we're doing, and then go through it. You can do that for ozone, water, you name it.
And his smile at the end. You know?
He's such a good guy.
Yeah, he's pretty top dog. So I've got one I can show if I can find it.
Wait, so in Tennessee they say top dog. In Maine they say wicked chap. So
Wicked shot.
wicked chap.
Oh, let's see. Let me see if I can find this a year ago. I don't know if he's still got it up.
Is this the commercial your client did? Kind of like when he
Yeah,
came
it's a
in?
video, and I'm looking at his Facebook page right now, trying to find this
Yeah.
video that says a year ago, and we don't want a year ago. So
What's his name?
Shannara, Montevallo Family Dentistry. 22 weeks ago. What's with this weeks thing? I don't know. Yeah, maybe I don't have it up here anymore.
They're in Alabama.
Yep. I'm looking on their video page and I don't see it, but I have shown it so many times. It's so good. Maybe they took it down. I don't know. Yeah.
I have a question for my team. Has Dr. Pierre ever had anyone who manages like all the social media and stuff like that? for the office?
Good question.
I don't
It's
think
it's
so.
an array of people, but not any one person. Dr. Stevens does a lot, and Kelly, and I have access to it, but I'm not good at actually doing
that-
it unless somebody tells me to.
Is that just the Facebook that they do, or do they do all?
It's just
He had someone come in and do a video within the office. He had patients come in to be their
For-
models, and the guy came in and did a video. I don't know where it was sent, if it was on like our website
I
years
think that's-
ago,
I
but
think
that's
it
the
was
only
just-
time. Yeah, but there was a video that was created years ago.
Yeah, so Eric, why don't you, would y'all like to pull up your page and kind of look at it, see what's going on? We could do a little analysis here. I think Eric's really
Yep.
good at that.
So I manage Debbie's office Facebook page, and I manage Dr. Netzley's office Facebook page. Let's go Facebook, Mount Pleasant, right?
I think I
That
mentioned
was-
to Leanne not long ago about getting some pictures up of the new office.
Mm-hmm.
I think something that would be good to do too, now that we split into two practices, is actually, because I looked at the page yesterday, because I don't look at it, and the Mount Pleasant page has a lot of pictures of people that are not there. It's quite dated.
There's no pictures of me.
Of course.
Oh, we got to change that real quick.
All right, let's see.
The last post was May 26th, or was that just a pin post?
Yeah, May 26, 2020. Here's your chance to join our team. And
We
then-
also have two different Facebooks now too.
Oh.
One for each office. So there's a
Okay.
North Pond Dental Care one too.
Okay. Yeah, so North Pond.
Yep.
Let's see, North Pond. Is it one word or two words?
It's 2 words.
Okay. Let's see what I get here. Is that it?
Yes.
So January 18th, that's new.
Mm-hmm.
Is that updated?
What's their profile picture? Okay, so that's the new office.
Yes.
It looks a little bit still under construction.
It's not anymore, so we should probably update that.
Update it. Yeah.
Yeah.
Yeah, look, you got to do a couple of things with social media. People want to connect with you. But what happens is when you have a certain number of followers, you have 142 people following this, about 10% of those people will see this post when there's no engagement, okay? Not even the likes, 10% of people will see it. So like 3 people like this one comment, that helps get more interaction. So what you guys can do is, yes, there needs to be posts. Honestly, the content isn't as important as you might think. We think, oh, educate them on periodontal disease and tooth replacement, that kind of stuff. No, that's not what people are on Facebook for, right? So you can actually do a job post from your business page where it wouldn't show up like this, so people wouldn't see it necessarily. Okay, so here's this January 18th. That's this year, right? Yeah, that's this year. So on this page, the same one, you had 50 likes and 2 comments. That probably got a lot of traction. So let's see how many people follow this page. 170 checked in. Oops. 546 follow. That's really good. So that tells me about 50 people a day see your post, because Facebook doesn't give things away for free. That's how they're worth billions of dollars. So you can pay $10 a post to boost it, or each of you every now and again can share the post. If you're willing to, it's amazing what it will do for your reach when it comes to Facebook. Like, you would look at this and you would see, oh, we had, and if you were managing the page, you could see how many people actually saw it. So like, for example, I like this page, I follow it, but I didn't see this post, right? It never came across my feed. So just because you follow it doesn't necessarily mean they're going to see it. So what you guys can do is comment on it, you can like it, but more importantly, you can share it. Now, by sharing it, it creates a ripple effect. And that means more people that you influence will see it and be more likely to come follow it, okay? The other thing you guys can do is if you're all made an administrator of the page for a day or two, just for a day or two, you can go in and it'll allow you, because you're an administrator, to invite all your friends on Facebook that you think should follow this page. Again, only if you're comfortable doing that. If you're not a Facebooker, don't worry about it. But I think the mistake we make is one or two people are administrator of the page forever, which is fine, but we need everybody to be an administrator at some point so that you can invite your people to follow the page. That way we expand our ripple effect.
That's a great idea, Eric.
And then after then you're not made administrator anymore. They take you off after a week or whatever, because you're going to get all kinds of notifications about what's happening on this page, and you don't want that. But afterwards, then as you see posts, you want to share them. Share them to a group. If you're a part of a, something local in your neighborhood, it could be, neighborhood watch, something like that. If you guys are doing something, share it to that group, that page. That's, again, going to expand your ripple effect. Sharing is way better than a like. It's a lot better than a comment. And sharing is the way to go, especially if you can do it to your page or to a group. Does that make sense? Any questions about your pages?
Do you think it's good that we have two separate pages, or should it just be one?
How close are they physically?
10 minutes apart.
No, I think it's okay.
I think just knowing about your database, where they're trying to get patients to, the last I heard, you're trying to get patients to choose one office or the other and stay there. So because your Dentrix doesn't share with each other. So I think having two pages is probably a good idea.
So I help manage Dr. Netzley's page. And here's the post I just did, right? So you can see what I see. You're on the inside now. You can see what I post. This was yesterday. You can see it only reached 13 people. But if you look, how many people like this page? I can't see that because we're looking at it from my perspective. Here it is. 192 people like the page, but yet we're only reaching 14 people at a time. Why? Because I need people to engage with the post. So I need the team to comment, share, do something with the post. Or what Dr. Netzley likes to do is he goes and clicks on this button and he pays $10 a week to boost one of the posts. And you can see the difference when they do that. If I could find one of these, let's see. I know that you guys did one. Oh, and it's important for them to interject personal stuff in between all these. I'm doing the frequency, right? I'm doing the volume part, and then he needs to do the inside quality part, right? Has to be both, okay? I know we boosted one recently.
I have is like, obviously this is super important if you need new patients, but if your need is not new patients, which obviously eventually would be, what would be the other thing that doing social media would bring?
Yeah, just connection. You're staying in front of them, right? So what was my hygienist's name? Oh, what's her name, right? So you guys want to do more personal attention. You might do, look, here's what happens. If you do fewer posts, you're going to start to fall off of their feed. So by maintaining a frequency of posts, and you start to, it's like trolling when you fish versus standing on the sideline and just throwing in the same spot over and over again. You need to troll. You need to get out in the boat and drive out. So this is I think he boosted this post and it reached way more people. What has to happen now is we need to share. So if you go to the top, right, we need to share these posts to a group. So you can go on, right, and I can hit share to a group. And I can choose whatever group I want. And it's better to do it on your phone. And I don't ever do this on the computer, but it's sharing to a group. I got to go find the group. I'd have to go through all these. I could share it to DenVantage. Look at that. I could share it to DenVantage and say, looking for a great dentist in Fresno who offers DenVantage, and see what DenVantage would get me. Okay. Make sense? But you have to personally be in that group to do it. Now, if you're not looking for more people, you don't need to do that as much. You might just comment, love my office, love working here. You might ask your patients to do reviews. Every time one of my clients that I manage gets a review, I comment on it, okay? Make sense?
And I like, Facebook is about faces. I think people, I've got a picture, Eric's sharing right now, but I've got a picture of somebody who just put up a birthday cake and it didn't even have any frosting on it. and they put this birthday cake picture up on their Facebook. There were no people in it. It wasn't even pretty. And you know, they expect somebody to respond to that. Or let's say it was assistant day and we gave flowers to the assistant. So they're putting up pictures of the flowers, but there's no people in the picture.
If you're going to do that, you got to put yourselves in it. That's what people like to see. So you can see Ted Morgan's office, there's 900 people follow it, but Facebook's only going to allow 36 people to see it. That's way less than the 10%. That's like less than 5%. But as soon as I get someone engaging, right, I get 84 people to see it. So I got 2 comments and I got 1 share. Okay. So one person shares it and it takes off. Okay. So if you're looking for more patients, there's a way to do Facebook and a way to do that. And if you're not looking for Facebook, if you're not looking for more patients, then what you want to do is just have your personal engagement in it.
It keeps your existing patients
Connected.
Seeing you, and that you're up to date, you're, you know, high tech. I mean, they're
relative.
watching.
Yeah, you're relative.
I mean, if they go on your page and you haven't posted anything in a year or 6 months, they're kind of like, what's wrong with them? You know, so you have to keep it frequent. How many posts a week, Eric?
I do 4 as a minimum. So I do 4, and I suggest my clients do 1 of their own personally a week. So just take a picture of someone walking down the aisle. Hey, love to see you guys here. You know, just a fancy wave and post it. It doesn't have to be overdone. There's raw is better, right? You know, my wife, we were on vacation somewhere similar to where Debbie is today, and the ocean was in the background, and these young girls were taking these selfies for each other, right? They're like hand on the hip and doing all these sorts of things, and they were young and doing their thing. And then this lady walked by and she's like, oh, can I give you my camera and have you do this? And she kind of backs up, and then I go, oh no. And this wave just goes, bam, just knocks her over. And I go, I guarantee you she got more follows and likes and comments on that picture than the girls did on theirs.
Probably.
It's real.
I love the video that that Debbie, your practice, did with the paint can.
Oh gosh, yeah, that got a lot of response.
Yeah, it's
Eric,
real.
Can you find that one and show it? But here's what I was talking about. This is actual post of a team. They put up the flowers. I mean, no picture. And here's the cake. This is the actual post. Yeah, that looks delicious, right? Yeah, no frosting. And they put that up just like that. I'm like, seriously? You got to be kidding.
Any recommendations of other social media platforms to use at this point, or is Facebook?
So everything I post, like for Debbie's office, it mirrors to Instagram. So I see everything that happens on Instagram versus Facebook. And some offices get twice as many views on Instagram as they do Facebook. Right now, Instagram doesn't create the interaction that I get on Facebook for new patients. Like I'll get a message or review. So reviews are huge on Facebook. You can't do a review on Instagram. So on Facebook, you get the review and then you get a comment or a message from a patient saying, I'll get comments. Do you do cleanings? Do you take new patients? Whatever it is. You're like, yeah, we'd be happy to help you. I had a client tell me, I've never gotten a patient off of Facebook. And I go, well, because you're not using it. You're not doing anything. Of course you haven't. You know, actually, let me show you this. This is just as good, Paula, from there.
Okay.
This is great. I love this one. So this view, right? Does this look familiar, Debbie?
Yeah.
Right? And look at the reach. Not 36 people, right?
Wow.
Right? Why is that? Because 63 people liked it and 22 comments. And most importantly, it got 2 shares. Okay. Now, those were private shares that someone did that aren't public. So it won't get as many, but still. You compare that to a normal post that I do, 128. And somebody would say, well, why do you keep doing regular posts, Eric, if they're not reaching so many people? Why? Because I got to keep them, I got to stay on their feed. I got to have frequency too. You can't do one or the other. It's got to be both.
There's the paint can. Isn't that the paint can? It says, here's a laugh for all those who need. Is that the one?
1.9 thousand views 45 weeks ago.
Show the video. Yeah, this is awesome.
Look at these ladies painting walls.
Oh no.
It's making Morgan Dental Care look beautiful. Stay healthy and safe out there.
That was real.
That's the lady on the beach getting plowed by the wave, right?
Isn't that awesome? I mean, that's just.
And they were willing to post it. They were willing to post it, you know.
Look at Jen. Jen just going. I know.
So, and then they have views. You know, they have videos 1,000 views. There's one on here that's got a ton of views that you guys did almost like a commercial, Debbie. Look at this one, 8.2 thousand views.
Wow.
Okay. So, oh, look at these guys. Look at
Oh,
those
the
dancing
flossing.
moves. Yeah, you got the flossing. 6.3 thousand views. I mean,
Yep, there you go.
6,300. And I wish I could find the one. There's one on here. It's had 80,000 views. It must be an older one. And it's just, just talking to a patient. It's more like patient testimonial. But again, those are the things that you do. You insert in between the regular 4-day-a-week post stuff, you know? Make sense?
Eric, can we talk about the Google business page? I think that's often overlooked. And I've pulled up teams. I mean, I pulled up one the other day, a Google business page for a team, and said, hey, we need to update this. And there was one of the team members in there now, and there was a picture of her when she was a little girl, and she's actually working as an assistant in there now, and her mom works in the practice. So, I mean, it was like 10 years old. And so we want to make sure the Google business page is updated with the right pictures and the right office hours, and also making sure that Google reviews show up and the Facebook reviews. You mentioned the Facebook reviews. Yeah. You have to make sure those connect to the Google business page.
And your text messaging system should be driving this right here.
Yeah, there's only 46. There should be way more.
And you will say to the patient, hey, I'm going to send you a text message when you're done. And I'd love it if you'd leave a review. There's so many patients out there that don't know where they can go, where it's safe to go. And they'd love to hear from you. Would you mind leaving us a review? Pretty easy to do.
Okay. That's, and see, you can do see photos. A lot of people will use the Google business page before they use your website. They go there first. All right. Yeah, there's 176. That's awesome.
They get a lot of Facebook reviews because I'm constantly responding a thank you to them. And it's not votes. That's not how many it is. So.
Yeah. Right. So you want to make sure the photos are up to date. When you click on see photos, you can look at all the pictures in there. Make sure that's still the team you have right there. Yep. If you have team members in there, I like putting team members pictures in this part. Does your office still look like that? Yeah, there's Brett. This is good. That's really good.
Look, you got to get your pictures in there too, right? That's it.
Yeah.
Because I want to know who I'm going to see.
Their building's a different color, and they look at the Google photos, and it's not like that at all. So, yeah, these are just marketing things. Good questions. We love talking about this, don't we, Eric?
Oh my gosh. Well, and I'll say this, as a consumer, like I'm looking for a new chiropractor, right? And I want to know who I'm going to see. Am I going to man hands? Or am I going to go to somebody who's really going to take care of me in a way? And honestly, visual, we talked about making a judgment, right? It's like 3 seconds to make a judgment. It's less now, Paula. I don't know, but it's crazy. But I want to see who is going to take care of me. I want to know who I'm seeing. I want to see that person. And that's based upon my past experiences, right? So we have to make sure that the patient has eyes to the inside of the building. If I have the opportunity to go to 2 restaurants, I'm new to town, I see 2 restaurants and one's a brick building and I can't see inside, and there's all glass, I can see all the people inside having a good time, I'm pulling into the one where I see all the people.
Yeah.
I know that I can trust that because other people they're not dying upon eating the food, right? They're in there. So you need to allow them to see inside your place of business. So they're going to look for, when they look inside your website, they're going to look for you, they're going to look for your dentistry, and they're going to look for testimonials, right? And then now they're looking for safety as well.
Yeah.
Okay.
Good point.
All right. Good stuff.
Okay. So let's wrap up the day, the 2 days. Let's go into some action items. So let's review some action items that we have, and let's review some aha moments like we did yesterday. That was really fun. That's one of my favorite things to do. So action plan, get out your notes, and let's go back through. I've got, I don't know, 8 pages of notes now. And see, let's do a quick review through all the topics that we covered and what we got from that, what we're going to implement. So what did we cover the first day? And that feels like a week ago. So we talked about go to the index of your manual, if you like, pull out your notes. So we had the bridge of purpose. We talked about hygiene vision, team meetings, self-esteem, transfer your fears, team harmony, control dramas, one-on-ones, DISC, asking questions, phone skills. We didn't talk a whole lot about phone skills, a little bit. 5 levels of the new patient visit, scheduling, the times for hygiene procedures, the hygiene standard of care, closing word pictures, existing patient SWOT, the doctor. We talked about insurance, objections, cancellations, recare system, contacting patients who have been in a
I'm
while.
tired.
Yeah.
So many things.
Jeez. Okay. Marketing. So what are some action items? Let's go with that first. What are some things y'all are going to do that you wrote down on your action plan you're going to take back to your team? Why don't we start with Jen?
I think a big thing for me personally is just coming up with my own personal vision for hygiene. I think I need to do that for myself. I would like to see us as a team, whether we continue as a big team between Mount Pleasant Dental Care and North Pond. I mean, I want to continue us to be a team, but we're honestly 2 separate practices. But however that can work, I mean, it's been tough. I mean, I feel like I've gone through a divorce a little bit. I don't need to be negative, but I have truly dear friends I don't see anymore. But I would love how us to be able to stay together and be all trained under the same thing, highly trained, skilled. But so I would love for us to be able to continue that if and make that happen.
Gotcha.
I think also for me, getting back to the SWOT. I think I need to be better personally, getting back to the SWOT just on a day-to-day basis. Just doing that for my regular patients that maybe I have seen for 15 years and beyond, and I haven't done that. And that's where I'm going to be better in the next months going on.
That's awesome. That's great. I mean, we've had, I mean, you guys, it was crisis in the spring with COVID closure and new office and regrouping and all the things you've been through, and entropy happens, where things gravitate to disorder, and just getting back on track. This is a good time to be looking at that. So thanks, Jen. That's really awesome.
Yeah, that's good.
All right. Julie, want to go next? Action plan, aha moments.
So I want to be better at the FMX visit, doing the conversion exam and getting back on track with patients that I've been seeing for a long time. And also, since I've started at North Pond, I'm seeing a lot more new patients. So it's been hard for me because I was at Mount Pleasant for 15 years, and now all of a sudden I'm seeing all these new people. It's good and bad. and I feel like the doctors are always telling us when they come in the room, this is what they want to hear. And I think all of us are very good about transferring that trust, but they still are not good at asking for the cue. They just come in and they start talking, and then they've just messed up the whole the whole system. Because I have down exactly what I want to say, and I know the other hygienists that I work with share the same frustration, and they don't give me the opportunity to say it. And
Gotcha.
then they keep saying, well, you need to keep doing this at every single appointment. But Dr. Pierre, I think we've trained him after all this time. He's better, but he needs some help. And the other two, definitely, we need to work with them on it.
So you want to get permission and have a one-on-one. And then the other thing you can do is when they come in and start taking over, you can just interject with a question and say, would you like to know what we've been talking about? Just interject that question. So would you like to know what we've been discussing before you came in?
Yes. Yeah. That's a good way to do it. Sometimes they're taking their gloves off and ready to walk out the door, and they haven't even. It's happened several times.
Yeah, they need that feedback. Have a one-on-one with them.
Yeah. I've got a doctor I work with in the Bay Area, and again, it's 2-doctor practice. They have expanded function dental assistants. They have team assisted hygiene. It's a phenomenal. They do great dentistry, but it's a busy office.
Yeah.
And when it's busier, you get the sense of I got to keep moving. I got to keep going. I got to move. And sometimes you just need to like take a deep breath and sit down. And so with Dr. P, I won't say his name, Dr. P there, I'm like, look, and he's an I personality too. So even more so. So he just walks in and starts talking, and it's like, okay, your hygienist is going to make eye contact with you, like big eyes, make eye contact with you. And then you're going to go, okay, so fill me in. And I have to have that conversation. And they have to say, remember, Dr. P, let us fill you in. Let us fill you in. And then the transfers actually are happening. Otherwise, he'll just keep going. And then he's like reviewing all the same stuff we've done. And sometimes even underselling things we've already got patient commitment to.
Or they ask the patient if they have any concerns that they want to share. And it's like, oh, I've already asked that, and I have it all ready to say to you.
Yeah.
It really upsets me.
I put that on a agenda for a team meeting, and hygiene meeting or something like that, where you're inviting them to come and I need your help. And
it's very similar, Julie, to when any person walks in and goes, what brings you in today? When the admin team asks the same questions. So I know exactly what how you're feeling and what you're thinking about that. It's that we got to use the law of research. We got to use that.
Yeah.
We've just had to deal with that same situation, only the opposite way. We have a hygienist that won't be quiet when the doctor comes in.
Oh, wow.
Which is really unusual. So the doctor is standing there waiting for her. So we've had to have a team meeting, and we have role played and role played and role played. And that's the only way to get it through.
Yeah, for sure.
Repetition.
By the way, I have to tell you something. I have a team who was role playing the spouse objection we were talking about. And she's a D team member, and the spouse objection came up and in the role play, and she turned around and she said, this really makes me mad at women that have to go home and ask their husbands, because she just got out of a bad marriage. And I'm like, oh. I mean, that was really funny. So anyway, sidebar.
Men. Ugh,
I know, really. Seriously. Kayla.
I think my biggest thing is because I'm not great with the word pictures, I want to work on that. But I also think if I use the intraoral camera more, then I have something to help me speak. There's a actual picture right there. So I need to work on that. I think when we were talking about teaching your patient, if you reschedule your patient a lot, you're teaching them to reschedule, or if you're late, you're teaching them to be late. And I think we do a lot of rescheduling, and there's a lot of lateness, not necessarily in hygiene, but
yeah,
I want to bring that back to them to see if we can get back to that.
Yeah, teaches them to cancel. It really does.
Mm-hmm. Yeah, that's good.
Okay, very good. Very good. So, Dr. Netfley. action items, Dr. Netzley or
Hello.
Hello.
Hygienist permissions statement.
Permission statement.
Are you concerned? 5 love language. Ask more questions. A better preamble before swap. The emergency patient return. Why aren't they returning?
Yeah. Like a new patient audit almost.
Insurance question. If they don't pay, what are you going to do? Conditions.
Yeah, conditions. Yeah.
Do you think an infection is going to wait for COVID?
You're getting your echo again, aren't you?
Yes, I don't know what the.
he's hearing himself twice.
Yeah.
It's the worst when you hear yourself twice. Trust me, I don't like hearing myself once. That's a good list, Dr. Netzley.
I love Debbie tone of voice when she was asking questions.
Yeah.
Yeah.
Yeah, she's good, isn't she?
You talk about August. That's very different from today in our political environment.
Yes. Yes. Sure.
So, Katie, do you have something you want to add to that with your doctor?
Just some of my action points. Just trying to limit or trying to not do the limiting terms, like a little bit of reading here. I'm constantly saying it like that, so I need to avoid saying that.
That's great.
And incorporate word pictures more as well.
Good. So one thing that you guys can all do is have a blank whiteboard, flip chart, whatever you want. Could be a piece of paper on the kitchen table. Anytime you hear a limiting term, write it down. It doesn't need to be yours. It could be somebody else who said it. You don't have to say who done it. Just write it down. And that way, when I walk in the room and I go, oh, try to stop using limiting. I wonder if I'm saying try. What if that's me? And then now I'm conscious of it and I'll be aware of it if it comes up again.
That's good. Anything else, Katie? Yep, that was good. Okay. All right. Lauren?
For a minute. Hi. Sorry, I have kids home from school now.
Yeah, that's okay.
Okay. So for me, I think that my aha moment has been that I don't know a lot about how things work in the office. So I need to learn that so that I can better serve myself and my patients and my teammates. And I think that for myself, I just need to keep fine-tuning my skills. And this is a good reminder for me of the things that I need to work on. And yeah,
it's great.
I already made some action plans from yesterday's, and then after I kind of process today, I'll probably do some for today.
Yeah, so that's something that we'll want everyone to do, is to go to the end of your manual and find your action plan page. So let me call that back up here.
And while she's looking for that, Lauren, I would say this: what will help in understanding, hey, how do we do things? Every system needs to have a team lead on it, so you know where to go. So if you're trying to figure out, what do we do? How often are we doing perio charting? You have somebody who's in charge of perio charting. You just go to that person and say, hey, I'm checking in on this. It could be the smallest little system. It doesn't need to be, we have a hygiene leader. No, you break it down by system.
Page 127, 128 is your action plan. And, you may have several things. You may have to bracket it to prioritize what you're going to do first and get a time frame on it and who's going to help you. So this is kind of the smart goal plan.
Yep.
So good deal.
Good.
So Missy, are you there?
I am.
All right. You want to share with us?
Yeah, of course. So I think the first thing that I'm going to work on, probably this weekend, is my vision for myself and as a professional. and get some ideas together, so that hopefully in the next few weeks we can go over our hygiene, our department vision. That's something that I really think I will benefit from. The other things that we've definitely talked about yesterday was the perio percentages. That's something that, like Lauren was just saying, there's a lot of things in the office that she doesn't know how they work. I don't either. And that's one thing that I want to work on, pulling like different reports, seeing who's overdue. I'm seeing a lot of new patients still that I haven't met before. And so I think I've been doing pretty well with getting to know the patients and asking them questions, because it's kind of like, oh, it's the first time I've met you. Tell me about yourself. And so I'm going to work better, or trying to do more with the swatting of existing patients that have been there for a while. But I think it'll be a little bit easier for me because I haven't met them before. And yeah, and then I want to work on all the different personalities, because I'm a high I and I can just talk and talk and talk. And I feel like I need to learn how to talk with those different personalities. So yeah.
Yeah, perfect. That's awesome. What a great list.
Wow, that's good.
So, yeah,
Thank
I
you.
mean, I'm really excited for everybody to get back and talk with your team. And one thing that can happen is we have a weekend in front of us, and the conversation kind of disappears. So that's why we want to have things written down and have a meeting planned where we can discuss and share. So, Debbie, is there anything you'd like to share to kind of close us out? Give us some words of wisdom. We thank you so much, Debbie, for joining us. And
Well, thank you for having me. It's actually a good review for me too, because I've worked with a few of you in the years past, Jen and Julie. And I remember my first day after boot camp and after learning all these tools, it was like, oh my gosh, there's no way I can remember all of that. So I had to break it down, work on this for a period of time, then take the next thing and work, and then the next thing.
yeah,
And then before you know it, 20 years later, it's ingrained in you.
yeah, that you own it. You obviously own it. And that's one reason we wanted to have you join
Yeah.
Oh,
us.
thank you.
You practice, you walk the talk. So you have
I
to.
work for Ted. I couldn't do it any other way.
That's right. That's exactly right. All right. So anything else, Eric, you want to add? Or?
I just have a question for Debbie, just because of that paragraph right there. Clients will ask often, Debbie, how do you maintain that level of commitment to the skills so that they don't disappear? How do you make it stick? How does the doctor create accountability? What do you think is the magic recipe for maintaining that skill set?
Well, for one thing, we keep doing courses like this. We were with Paula not that long ago, twice now, I think, in the last year.
Yeah.
So each time you do it, it just brings it to the forefront. And then it also, you SWOT it. And okay, this is where we're weak. So this is what we work on now. And then you see the results of that. And then you take it to the next level at a team meeting. Keep SWOTing at your team meetings and keep figuring
Repetition.
out where everybody is. It's
Yeah.
hard. It's
is.
not easy.
Yeah.
And especially with team change, I know one time I was with you guys, and it was like half your team was new and half your team had been there a while, and we kind of assume everybody knows, and kind of like what you're saying, Lauren, and that's not necessarily the case, and so we have to kind of keep communicating and stepping back and practicing and all those things that you guys do on a regular basis.
And everybody has their own style. That's something that in our office, people tend to look at me and it's like, oh, it should be done like she does it. No, it needs to be done using the formulas, but it needs to be done with your style and your personality. It's going to come across differently, but the same, if that
Yeah,
makes sense.
same
You're going to get
results.
the same result.
Yeah. You can't be robots. You can't be scripted. It has to come from the heart. And you have to really want to do it. I think, what I'm hearing you say is everybody's got to be willing, right? Everybody's got to be willing to try and do this on a consistent basis, and you got to keep going back to it. Otherwise it will disappear. And if I see it disappearing from you, then I'll feel like, oh, it's okay. It disappeared from her too. And me, and I don't feel bad, but if we're all maintaining and we have leadership and accountability and people are saying, hey, don't forget, remember to do this, it'll be more likely to stick. Yeah.
Eric, what you're saying reminds me of the 5 levels of commitment that's on page 126.
Oh, I don't want to talk about those. I'm just kidding.
We have our I don't want to, which is a level of I just want my paycheck. Don't really want to worry about all these skills, or I want results, but I don't want to work for them. That's the way I feel about my workout program. my diet, just give me the body I want and then I'll skip the work, or I might, where we have our list of conditions, I might go outside and take a walk if it's in the 60s. I can't handle colder than that. I can't handle hotter than that. Just, in the 60s. That's it. I'll do my best, which leaves room for something else, which is I'll do whatever it takes. And I love this quote from Churchill. It's no use saying we're doing our best. You've got to succeed at doing what's necessary. And Dr. Allgood, I like choosing a theme for the year. And Dr. Allgood had for his theme for the year one time, we're going to do what's necessary. I thought that was awesome, of just doing what's necessary. So
yeah, whatever it takes. Yeah, it's good.
I like this. That's the willing wit right here, willing wit, whatever it takes. If you're serious about your goals, drop the conditions. Go directly to your goal. Be your goal. Conditions often disguise strategies for escaping accountability. Why not just take charge and create the experience you're looking for? So, sometimes you can ask your whole team to talk about what level of commitment they are. Some doctors, are even at level 3, and they expect their team to be here, but they're going to reach that level 3 lid in their leadership, and they can't get their team to be at a level 5 if they're only at a level 3. So that can be a challenge sometimes, but all right. So I think we have done an awesome job. I think we've covered a lot of ground, and you guys have been such great listeners and participants. I really appreciate you being here. And for those watching the video, I hope you get a lot out of this, and share with your team, and keep watching. Like Debbie said, repetition. We need the repetition. And I even learn. I mean, Eric, we've been doing this a long time. Debbie's been doing this a long time. We're still learning, aren't we?
Yeah. No, and I'm reminded, it's easy to do, easy to forget your self-talk every day right when you wake up. Start your self-talk. Start reminding you your I am statements, what you're going to do. Predict the day. Talk about how the day is going to be successful. And then constantly be learning. I love my YouTube book list because I know I can go back in there, I can choose something and either listen to it again or something I haven't listened to yet. So create a list of things you want to go back to and learn. You don't always have time to get to it right then. Podcasts, whatever it might be. Have something that you can, grab a hold of new, because that helps keep you fired up.
Excellent. So I will be emailing your CE certificates, and if you do not get that, I'm going to email it here in just a little bit. Please let me know.